Hi, my name is Erica Casada York. I am a midwife at Professional Gynecological Services here in Brooklyn. I would like to talk with you all today about a procedure called a colposcopy. Colposcopy is the name of a small procedure that we do usually in the office if someone has had a pap smear come back with an abnormal result. What we end up doing with a colposcopy is that you are set up on an exam table just like you might be for any other GYN exam. We insert a speculum, which is the little clamp-shaped instrument that goes inside the vagina to hold it open so that we can visualize your cervix. And we have a nice, very bright light. And what we're going to be doing is taking a few small samples from the outside of the cervix itself. We do this because something might have come back on the pap smear showing an early change in the way that the cells on the outside of the cervix look. It does not look like cancer, but it looks like something that might be precancerous, and we want to get a closer look and just make sure that everything is okay. What we do during the exam is we look through a special microscope that is close to my face, and so I'm looking through the microscope, through the speculum at your cervix so that I can see really what does your cervix look like. And I look at your cervix on its own. I don't touch it. I take a little spray that has acetic acid. Acetic acid is basically white vinegar. So this is a solution that has some white vinegar and some water in it, and I spray that over the outside of the cervix. This acetic acid happens to interact with quickly growing cells, and so I can see on the outside of your cervix that there might be spots where there's like a whiteness from that acetic acid solution. And if I see that whiteness, I'm going to want to take a biopsy there. If I adjust the light that I have and I see that there are some changes under the light, I'm going to want to take a biopsy there. The biopsy that we take during a colposcopy is very, very, very small. I usually tell people it's about the size of a sesame seed. You're not going to have scarring on the cervix afterward. It's not going to affect your overall physical health, sexual health, your ability to become pregnant or carry a pregnancy or anything like that, to have this kind of procedure done, because the biopsies that are taken themselves are so small. After you've had a colposcopy done and your cervix has had a chance to heal, if I go back in later and do an exam, I'm not going to see any scarring left behind there. We take the biopsies. They're very, very tiny. We typically do a little spray anesthetic before doing a little pinch. It is just kind of like a little pinch. Take the little sample, put that aside, label that container very specifically with the location. We treat your cervix like the face of a clock and say this one is from 1 o'clock or this one is from 6 o'clock, and label the biopsy specimens in that way. We also always want to get an endocervical specimen. So the endocervix is the opening between your vagina and your uterus. That if you think of your cervix as essentially a passageway, which it is, which normally stays closed, there is still this very, 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 very small little hole of the cervix. The hole itself is called the os, OS, and the part that is inside that is called the endocervix, as in inside the cervix. We take another little tool and gently place that inside the opening of the cervix and sort of twirl that a little bit to get a little bit of this tissue. The reason why we take this particular sample is because we can't see inside that passageway the same way that we can see on the outside, the face of the cervix. And also we know that there is very quick cell growth in this particular part of the cervix. And anywhere in your body where cells are growing faster, you have an increased risk for cancer to develop. We always also take a small biopsy. Again, it's a very small amount. It does not leave any scarring. It does not lead to any issues with your sexual health or your fertility or your pregnancy health at all, to take this sample as well. All of these samples, properly labeled, are sent to a pathology lab where technicians and physicians who are specially trained in this look at these samples under the microscope. These are not something that are run through some kind of an AI or computer algorithm. These are physical people with human brains who look at it and determine, okay, does this look like normal, healthy cervical tissue? Does this look like it has any kind of cancerous or precancerous changes? They write up their results and maybe they'll put in a few pictures. Usually they put in a few pictures and they send this back to me. And then I'm going to go over these results results with you in about 2 weeks after you've had the procedure done to say, we ended up taking 2 biopsies plus the endocervical sample, or we took 5 biopsies in the endocervical sample. Usually I'm able to tell you all of them came back totally fine. We want to see you again to repeat the pap test in 6 months to see if there are still any of these changes, or if this is tissue that maybe there was an infection, maybe there was something going on with your immune system, maybe that's why something looked a little unusual on the pap test, but your body has kind of recalibrated back to normal and we don't have these issues showing up anymore on your pap test. Sometimes a colposcopy will come back that one of these biopsies might be suspicious for a precancerous sign, or very rarely for cancer itself. And if that were to happen, then I would send you to GYN oncologist. This is somebody who specializes in GYN cancers, and you would have the possibility of having further procedures done to see, is this something that is very small in size and can just be removed surgically, or is this something that needs a more aggressive approach? That would be something that would not be handled in just a general GYN office. Typically, you would prefer to see a specialist for something like that. The good news is, for most people, colposcopy does come back normal. The procedure itself does not result, as I said, in any decrease in your sexual health, your fertility, your ability to carry a pregnancy. It's a very, very common procedure, and fortunately, it doesn't have a lot of effects down the road. If someone is recommending colposcopy to you, please ask lots of questions, because I want you to feel at ease and comfortable with this treatment option. But just be aware that it is very simple, very straightforward, very safe, and really helps to give us a lot of information to let us know how to treat you going forward, and help to give you peace of mind that you know what's going on inside, that you know that your cancer risk remains low, and that you're really staying on top of a very important aspect of your overall health. I hope this helped. If you have any questions, I would love to see you in the office. You can leave a comment. Please share this video around, and I will speak with you later.